Good afternoon, everyone. I'd like to call to order the special council meeting for August 18th for the town of Edgewood. First item on the agenda beyond call to order is the Pledge of Allegiance, if you'll join me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands,
one nation,
under God, indivisible, with liberty and justice for all. I salute the flag of the state of New Mexico and the Zia symbol of perfect friendship among united cultures. Thank you, everyone. First, we should have a roll call of councilors. Councilor Abraham, are you with us?
I am here.
Councilor Holly?
Present.
Councilor Jaramillo?
Present.
So we have our council here. We have the IT folks. We have people recording what's going on. We have the clerk treasurer, and we have the town's attorney. So the first item on the agenda is approval of the agenda, and I will stand for a motion.
Mayor Pro Tem, I'll make a motion to approve today's agenda.
And I'll second. Councilor Abraham, how do you vote?
Aye.
Councilor Jaramillo, how do you vote?
Aye.
Councilor Holly, how do you vote?
Aye.
Vote aye as well. First item on the agenda is public comment. I don't see on my screen who we have online, so hold on just a moment. Currently, I see two callers online with us. I guess since we have two callers online, we can start with the two callers. We will unmute caller number 2 if you could state your name and whether you wish to speak to this item. Caller number 2, you've been unmuted. I don't hear anyone at caller number 2. Caller number 3, we can unmute. Caller number 3, do you wish to speak in public comment regarding our discussion items today? Caller number 3, are you there? I guess there is.
This is Ralph. Hello.
Ralph Hill? Mr. Hill, do you wish to speak
Yes.
today?
Yes, I do.
Please go right ahead.
Okay. Concerning this mandated vaccine, the law is pretty clear that an experimental vaccine cannot be mandated. And I don't know if you're aware, you could be exposing the town to a civil suit should someone suffer an adverse event or death or termination from their place of employment because of the taking the vaccine or refusing to take the vaccine. I just kind of think you should be aware, some of the disorders that have happened from this experimental vaccine. And you probably should cover any person that contracts a problem, maybe under the health insurance plan or life policy or workman's comp. I just wanted to know if maybe the legal people there would not agree that there's a possible civil litigation problem. And that's what I had to say. Thank you.
Thank you, Mr. Hill. I don't see any other callers in there. I see some town staff, and that's really about it. So I guess we should move.
Mayor Pro Tem,
I've got a couple
I
of
have a
emails.
message that my husband Louis Abraham would like me to read on his behalf. He's at work and could not attend this meeting. So this is a message on behalf of Louis Abraham. I spent 22 years in the Navy to protect the freedom of U.S. citizens. Each one of you have the freedom to make your own medical choices without interference or retribution. You people that are vaccinated did so of your own choosing. It was a health decision you made based on your health conditions and beliefs. These employees have the same right to make their decisions as you did.
Is that it, Counselor?
That's it.
Thank you very much. I believe that our town clerk has several emails that he received that he wishes to read into the record as well.
Yes, Mayor Pro Tem, Council. So the first one is from Cheryl Hubbards. Pro Tem Mayor and Council, I understand that the governor has mandated government employees to wear masks and those unvaccinated to be tested weekly. I do understand that hospitals are full and that New Mexico has limited resources, and we need to take extra care not to make their jobs harder with increased COVID hospitalizations.
Can you speak up?
I would request that you consider the spirit of the law, not the exact mandate. Please consider the following procedures that were in place under Mayor Bassett. Masks only required when meeting with the public and testing when there were symptoms of COVID. The staff at Town Hall is separated from each other in separate rooms except for P&Z and code enforcement and the front desk. Perhaps they could alternate days they work or work from home. There are only 7 employees located in Town Hall in quite a bit of space. At the police department, Nina is mostly there by herself. Only 2 police officers are on duty at a time, and they are mostly in the field. It seems pointless to wear masks. Excuse me. As far as testing for the unvaccinated, Governor stated that in her briefing that test kits were available from the health department and could be done at home. Personally, I believe testing the unvaccinated is very divisive. Vaccinated people can also get COVID. It would be better to test all people if they show symptoms. Thank you, Cheryl Hubbards. The next one I have is from Linda Hill. Discussion and consideration regarding a policy that all town of Edgewood employees shall present proof of vaccination against COVID-19 or proof of negative test every 7 days. This policy is against our God-given unalienable rights, our moral and social values. It is our job to protect our health, not the government. The government job is to protect our rights. I would think Edgewood employees have the knowledge to protect their health. If you trade their liberty for what you may think is your safety, we may lose both. Thank you, Linda Hill. And Mayor Pro Tem, Council, that is all I have.
Thank you, Mr. Torres. I guess we can move on into discussion. First item for discussion is that public meetings pursuant to the Open Meetings Act, including but not limited to meetings of the governing body, planning and zoning commission, shall be conducted by virtual and or electronic means until such time that an in-person meeting can safely be conducted to facilitate attendance by members of the public. I think you all know that the governor has basically asked us all to mask up again. And I think it's in everybody's interest to continue to practice at least some reasonable amount of protection, self-protection, and protection for others. So I'll entertain any discussion. Okay, well, do we have anyone who wishes to speak, councilors?
Oh, Linda Hawley is muted. You're muted. I just saw you talking.
Mayor Pro Tem, I do have a few comments on this.
Certainly. Councilor Holly.
Okay. All right.
I was going to say that I was okay with allowing participation at all public meetings to be in a hybrid model, in person and via virtual means at the participants' discretion, except of course for the governing body's participation in any closed session discussions, which should be in person as per our operating resolution 2021-03. However, now that the governor has issued a public health order mandating everyone wear masks in public settings indoors, I kind of changed my mind. I thought it would probably, since we've got to wear masks, I know we've heard comments from the public in the past that it's difficult to hear us, and I thought if we do decide to go virtual again, at least we could be home and not have to wear masks, and it might help the communication for everyone to be able to hear. So I guess I'm leaning on the side of going back to the virtual meetings in light of the fact that we would have to wear masks in the public setting. Thank you.
Anyone else, counselors?
I did want to ask you what your motion will be on this.
Well, counselor, there's very little that we can make motions on here. This is more of a discussion and consideration. I don't see any action. I don't see anything to act upon at this point. However, I am willing to listen to all the comments. As I had said in our last meeting, I will continue to talk to all of the employees, which I have done. I have talked to all of our departmental supervisors, that I have done. And I'm now listening to you guys. And we will see where we go. It is my hope that we can reinstate something like our original emergency mandate and go back to some of those things, because I think we need to at this point. But as I said, I'm willing to listen. So please.
On that part, I did request this to be action. And so you are in violation of the judge's writ and order.
Counselor, I think that if you were going to submit something to act upon, that you would have submitted it prior to the publication of our meeting agenda. Having not received anything, I didn't feel that there was anything to act upon. But please, pursue whichever direction you wish to.
We did come to a consensus that this special meeting topic would be making these decisions as a governing body, and so therefore, I could make the same argument to you. You have submitted us nothing within the 3 days. The agenda came out prior to the 3 days. You didn't ask us for anything, which you could have done. Did we just get this agenda and there it is? So, even in our last meeting, Councilor Abraham did the due diligence of contacting the Municipal League, and the Municipal League stated you have no authority to do this, that it is the action of the governing body that must be taken.
Well, Counselor, we are where we are currently, and if there's no further discussion on the first item, maybe we should move to the second.
Mr. Mayor Pro Tem, I do have some comments. After listening to Councilor Hawley, I came up with some ideas. You know, many places, restaurants and stuff, are putting in partitions to separate people but still be able to have more people in their restaurant. So my recommendation, what I would like to see us possibly move forward with, is the hybrid meetings. If people want to come in person, they can come, they can wear their mask. that can be removed at the microphone to speak, that those of us who are having up on the dais could have partitions between us and between kind of like little glass cases with our microphones inside, so that the public could hear us and could see us, and could interact with us more completely.
I think we can take that suggestion and see where we can go with it.
I did want to find out from the other counselors if this is something that you would like to take action on as a governing body. Hearing that the Municipal League has already stated that Mayor Pro Tem does not have the authority, that it has to be resolution, ordinance, or policy approved by the governing body. I think that we can talk today and we can discuss, but we do need to immediately, set another agenda that's going to have action for the governing body to take.
I am agreeable to that. I don't think we can move forward just discussing things. We definitely need to make decisions. And the only way to do that is to have it for action. But I would say I am not up for another special meeting. I'm just not. I'm tired of the number of meetings that we have. I think we need to stop imposing these on our citizens to be informed. They shouldn't have to be here in the middle of the day. They shouldn't have to have meetings every week. I know I would like to limit our meetings to twice a month and not go beyond that. I think we used to be able to get our business done in that time frame, and I think we still need to be able to.
I agree in general principle, but I also know that this topic is of urgency and can be critical, to preventing injuries and saving lives, whether it's from the virus itself or the vaccine. I mean, I've seen it on both sides. In my personal circles, much more on the vaccination side, I've seen very negative impacts. So, but I'm just saying that either way, because of the scenario that we're in, I do think it's important to address these issues right away. I just think that we need to follow legal guidance that's already been given to us, and definitely make some decisions as a council, as a governing body, because this does impact the employees and it does impact the services to the town, and really the rights and freedoms of the employees. So we need to not take this lightly, and should be a decision together. So I guess what I'm asking for is for agenda items to be put on for action, as I already did ask, and wanted to find out how council feels about that. And I guess do we have a meeting next Wednesday?
We do.
So we could add it on there for action. Are you guys agreeable to that?
Could we also get like a preliminary agenda to see what maybe we could take off so that we can properly deal with this?
Well, councilors, I have no problem discussing the agenda for next week. If you want to have another meeting next week to discuss this, we can certainly limit the number of items. There are a couple of things, of course, that we're going to have on there, but we can certainly limit it if that's what you wish.
I would like to make this our main topic of our next meeting and limit everything that we possibly can. I would like to have no consent agenda items. I think we need to just pass on those for a while and just focus on immediate things that need to be taken care of, and these do all need to be on for action. Mr. Mayor Pro Tem,
Yes, Councilor Holly.
personally, I'm a little bit unhappy with all this talk. I think we all cleared our calendars so that we could meet today at 3 o'clock. I see there's nothing for action on this agenda, but we can certainly have our discussion since we're already all in the meeting. And if somebody wants to take action on something, I believe you've got to submit it and write out what it is that you want to take action on. So that's my thoughts. I'd like to continue the discussion, and that looks like all we can do today. That's what we've got on the agenda.
Okay, can I clarify, Mayor Pro Tem? So your items that you listed on the agenda were not for you to take action on? Am I understanding you correctly? Or Councilor Hawley correctly, I guess I should say. So if he's, Mayor Pro Tem is not taking action on these items, then we can certainly add these for action for Wednesday's meeting, and that's in writing. I don't see anything else that needs to be provided unless you have any ideas for us.
Councilor,
But as far as I'm concerned right now, we're not in the action phase if we're just discussing.
Councilor, I suggested.
I see you frowning, Councilor Holly, so I just want to understand, did I misinterpret? If this isn't for action, we could go ahead and discuss, but put it on the agenda for Wednesday for actual action of what's going to impact the employees.
I think we all know how this works. It's just discussion items. There's nothing on here that is requiring us to take action, so we cannot take action on anything on this agenda today.
Right, I understand that, but I'm saying that what I'm asking is, since there may need to be some sort of action taken, that we do that at our Wednesday meeting. Since the word action was not added to our agenda today, we do need to take action on something for the employees, right? And so that's the phase that we're in right now is discussion, but we need these back on an agenda for action.
So Council, I suggested in starting our discussion that the original emergency declaration, and I can't remember right now what the resolution numbers were.
2020-07.
2020-07, thank you, Councilor, that we bring back 2020-07, and that was my suggestion. Now,
We cannot bring it back as it is because it talks about school closures and all kinds of other things.
Well,
and you're now addressing things on here that weren't on there, such as
Councilor,
mandating
I am Councilor. I am well aware of that.
Okay.
It would be a new resolution. It would be 2021-something. And I would like your input from today's meeting in order to make that draft to present to you for our next council meeting. And that's how I would like to proceed. But I am willing to listen to how you would all like to proceed as well.
Okay, so that means that nothing will impact the employees until we
have
the resolution or not, right?
We have impacted the employees, Councilor. We've had reports of COVID among the staff, and there have been questions of staff of how they're going to deal with the 14-day quarantine and what happens if they come down with COVID symptoms and have to be out of work for a while. And right now, because we rescinded that original resolution, they don't have administrative leave. They have to take their sick leave and their annual leave and wish upon others donations of sick leave and annual leave. So I would like to see that reinstated, because that in and of itself is a very large burden on our employees. So yes, this has impacted our employees, and we do need to take action as a council. There are several other things that I would like to see us do, and I would like to include in a resolution that we would take a look at. I put these items in separation because they seem to all demand a separate discussion, but it seems like we are a little bit off the topics that are listed. So I don't know how you would like to proceed here, but we've kind of discussed A, and we've kind of started dipping into B and C a little bit. So I don't know where you want to go with this, but I had to tell you that my wish to do the right thing here is to bring back something similar to the emergency orders from last year. And
Okay, so
we can discuss
I'm
the
just
pieces
trying
of
to-
that.
Okay. Thank you for clarifying. And does that mean that we're not requiring employees to vax or test at this time until council makes a decision?
Counselor, if you read carefully my email and the policy, you would see in it that it is not a requirement to become vaccinated. However, if you
No, I said
have
vax or test.
If you have been vaccinated, we would like to know, and you can submit that, but it is not a requirement for vaccination. Secondly, testing. Testing is something I think we probably all should do. I've had it suggested to me by several employees, as well as several folks from the public now, that testing should not be just for people that are vaccinated, but everyone should be tested, because we don't know who's got this virus. And if someone does have it, it would be in their best interest to know it, because if you've been vaccinated, you might not even know it and be spreading it. So we're in a really interestingly serious predicament right now. This virus is a bit more insidious than its progenitor, and so I think we need to consider that. So something else that I would like you to consider with regard to item C, since we seem to be there now, what I would like you to consider there is allowing the town to procure the rapid tests and allowing them to be provided for all the town employees. And in fact, if you guys want to take the tests yourselves, you may. And I would encourage it. I'll be happy to take those tests as well. But we would provide that in-house. They're rapid tests, so the results come back rather quickly. We do know that the rapid tests are somewhat inaccurate, but if you get a positive, it would behoove the person who has that positive test to go and get tested with the more lengthy test and take some time away. And how else are we going to know? I don't think the test is the rapid test at least is not horribly invasive. So I would like to put that suggestion out to the council as well. I think keeping not only our employees safe and healthy, but anybody else who has dealings with the town in the town offices, that would be a really good thing to know, that our employees at least don't have the virus and are not spreading it amongst anyone.
Okay. All right. So I'm still trying to understand, because that was a really long answer to not answering me. Are you personally requiring anything of the employees between now and Wednesday?
Between now and Wednesday, I don't think we have, the policy has gone out. If employees would like to submit their vaccination records, and many have, that would be fine. They can bring them to the town clerk. he will file them and in their personnel records and seal them. That's where they're going to be. Nobody else gets to see them. And he.
You're assuming that this policy is passed in council.
I'm assuming,
and implement.
Counselor, I'm assuming I'm the chief executive officer and I have to take emergency action. And if you disagree with me, then you can certainly bring forward some action. However, at this particular point in time, as the executive for the town, I have to act because we have a situation. So yes, the policy has been sent out.
You have no authority to implement that according to the Municipal League.
So says you in the Municipal League, but we can certainly argue that. At this point, we have a serious problem.
Need council approval
And
to impact the employees.
Counselor, this isn't an argument that we need to have right
Yes,
now.
it is an argument.
If you have
I will argue for our employees.
and I'm
I
arguing
will
for our
argue
employees
for
as
our
well. I don't think
Don't try to cut me off. Don't try to cut me off and minimize the process that needs to happen here with the governing body. We do need to take action. And I'm not saying that I'm opposed to every single thing that you have brought forward. What I'm saying is that you do not have the authority to do this on your own. And this needs to be, as an action item. Before you start trying to implement things.
Counselor, you didn't bring anything forward, and I needed to talk to
Yes,
all of
we
our
did.
employees.
At the last meeting. At the last meeting, we absolutely did. We agreed that this would be on the agenda.
Right, but I need an agenda item. I need an actionable item, and I did not receive one. If you were going to author an action,
it's right there on the agenda that you drafted, didn't share with us, didn't ask us for anything that you may have needed. Considering this is an emergency, you have our emails. Mayor Pro Tem, I'm speaking. You have our phone number. You have our emails. If there was something that you needed prior to this meeting that is not listed on this agenda, which you didn't put for action anyway, that was your choice, you should have asked. We agreed at the last meeting that this would be on this meeting's agenda for action.
Well, Counselor, I did not put anything on there myself because I was in the process of talking to all of the town's employees, which has taken several days. And now I have it after consulting with the town's employees and listening to their concerns and their desires and their wishes, I know several things that the town's council needs to act on, and I have expressed them to you. And I plan on bringing those forward. If you had something that you wished to do, I would have hoped that you would have presented it before the deadline for this agenda. I'm sorry that you didn't.
We already discussed the actionable items at the last
But you didn't present anything, Counselor. I am sorry you didn't.
Something on the agenda. Let me just explain something to you. So I have asked previously for draft agendas. We do not receive those, okay? If I had a draft agenda that I would be able to look at and say, all right, he needs something for X, Y, Z. And if you had the decency to call me or email me, I could provide something to you if that's what you needed, okay? You didn't do that, all right? Instead, you drafted an agenda. Excuse me, I'm speaking. You drafted an agenda without action. Why, by Sunday, should I give you something that we can act on when it's not on there for action? You unilaterally chose to take this off as action.
Counselor?
That's your choice, not mine.
Counselor, if there's nothing to act on, how am I supposed to act on it?
Then why did we
There's
have
absolutely something to act on.
Well,
Why did
You
we
put
call
on the agenda.
for nothing.
Okay,
That's what I'm saying.
council,
We're-
this is getting way past off topic here. I
it's
think
not.
we need to, I
It's
think we need to
actually
roll
very
it back
pertinent.
to the agenda itself.
I do
And we have discussed several things on this agenda, not necessarily in the correct order. I think we need to get back to discussion of item B. I think that item B is pretty well defined by the governor's orders yesterday. I don't think we need to belabor it. And I think we have,
I do have a comment on each of these in order.
Okay.
I mean, I would like to have a chance to speak as well. So please, when you're done, please call on me.
Councilor Abraham, go right ahead.
Okay, so for item B, you have discussion and consideration regarding policy that recommendations from the Center of Disease Control, face coverings for vaccinated and unvaccinated employees indoors on property owned by the town of Edgewood and regarding closure of the town's facilities to public except by appointment only. I am okay with closing the town facilities for appointment only. I do have a problem, though, that if employees are in town hall, like somebody said, there's only 7 employees in town hall. They all have their own offices. The police officers are most likely in the car by themselves. That we make the policy they wear their mask when in contact within 6 feet of another, either employee or citizen. I don't think they need to go there and be face covered all day long sitting in an office by themselves. The same way with the police officers. I think they should be able to ride around in their police vehicles, which is property owned by the town, without wearing a mask. I totally agree that if you're going to mandate masks, that it should be for vaccinated and unvaccinated people as well. That prohibits the appearance of discrimination and harassment. So I would highly recommend that if we decide to close town hall, except for by appointment only, that our employees only have to wear masks at the time when they're interacting with citizens. That's my comment on that one. And I will wait until we actually get to number C to discuss my concerns with that. Mr. Mayor Pro Tem?
Yes, Councilor Holly.
I'd like to say I'm in agreement with Councilor Abraham on her comments on item B. The only thing I would say is I don't feel we need to shut down Town Hall again. If everyone's required to wear masks now in the public building, and I'm okay with the exception for staff when there's no other public in there. But if we've got the public coming in masked, I think we're all used to social distancing, and I don't think we usually have big crowds coming in there up to the front desk. So I don't feel it's necessary for us to close the town offices. Thank you.
And I did have some other recommendations. I think maybe we need to increase the cleaning. You know, make sure at night before you go home, if we're going to keep town hall open, that everything is sanitized. That people wipe down, wash their hands often, wipe down things. I mean, you know, that's kind of has fallen by the wayside. But, you know, practicing personal hygiene to help spread the transmission of disease is always important.
And I did also have feedback on the topic of, you know, if anyone is, for employees, and this is just common sense, but really just to reiterate, if anyone is having symptoms, that they be required to work from home or stay at home until, you know, they get tested or get asymptomatic, basically. From what I've read, you know, it's not really transmitted asymptomatically or on surfaces, and so the important thing, I think, is if somebody is starting to feel bad, even just a little, that they work from home or, use their judgment. They can go get a test if they wish, but they really shouldn't be in town hall, potentially spreading things, because we all know that the masks, even the studies are showing that the masks are not that effective. So anything can get through a mask, right? And so if anyone's having symptoms, that's the important thing, I think. Just use your common sense, stay home, take your personal medical choices that you have, but at the same time, protect others.
Any further discussion on item
would
B?
Agree. Just to kind of talking about, some of the other points that are brought up, I agree with Councilor Hawley and Abraham in the sense that I don't think that town hall or the meetings need to be closed. That's a personal judgment choice that people can make again, whether to come into town hall or not, and not something, even if Mayor Pro Tem, you felt uncomfortable, I'm sure you could join through GoToMeeting from your home. So that's something that each person is an adult. They're very well aware of how to conduct themselves and the choices to make. As far as leave for employees, I would be in favor of, providing the leave that's needed for anything that's absolutely required due to this virus. So, yeah.
Is that it?
I do think also that if town employees are interacting with the public, it's absolutely necessary, I would say, if they're within 6 feet, even if they're outside, if they're, really close to the public, but stating it as town property might be too extreme, because many times the police officers are by themselves, and so that's really not necessary. And if, the offices in town hall, like everyone has pointed out, Ms. Hubbard's included, the offices are huge. I mean, somebody could be in there alone, and there is so much space that, it's really not necessary to frame it up as all town property.
Okay.
Another comment that I had is just as we consider what action and what policy to implement, we need to be very, very careful to not take away people's freedoms and their rights. They have the right to privacy. They have the right to make medical choices or not make medical choices that they may not want to have done. So it is very, very important that from what I've heard from employees who are ready to quit, if they are forced to do certain medical procedures, that we do not force that. And that is why I'm asking that you hold off on any implementation of your original email until council has had time to make a decision. As well, this can be a tort claim, and it can be a tort claim against us personally as well. You need to be very careful. I'm sure each one of us does not want to be responsible for something very terrible happening. I'll just give you one example. I have two friends who lost vision as a result of taking the vaccine. Now, how would we feel if, we're forcing somebody, pressuring somebody to test, or finally they give in and take the vaccination, and then God forbid become really injured, can't drive, can't read, have to have eye surgery, whatever the case may be. That would be terrible, guys. We are not here, we're not doctors, we are not here to tell people what to do with their medical choices. That is not our job. And I absolutely agree with Linda Hill. If you go back to the purpose of government is to protect our rights, not to take them away and not to tell us what to do constantly. So the right to freedom is very, very crucial to this process. And so I think, looking at symptoms, if there's symptoms, definitely, that's something to address. But for the most part, they're all adults. They know what's good for them and for others.
So I guess, Counselor, you've addressed item C. Other counselors, do you wish to address item C?
I would. This is Counselor Abraham.
Go ahead, Counselor Abraham.
I had asked Juan and Carla and you to send out the personnel policy to all the rest of the governing body yesterday morning. Did you guys all get that? Did Linda, Audrey, did you get the personnel policy I asked Juan to send to you?
No, I did not.
Okay. Well, in that personnel policy, section 15 is about harassment. That's why I wanted you guys to be able to have that. It talks about one of the things that we say in our own personnel policy is that the town of Edgewood provides a work environment which all individuals are treated with respect and dignity. Each individual has the right to work in a professional environment that promotes equal opportunity and prohibits discriminatory practices, including harassment. So my thought is that unless we treat vaccinated and unvaccinated employees equally, then we are violating our personnel policy and creating a hostile work environment. And I do not want to be a part of that. Here's something that I have been thinking about and that I wrote up to address this specifically. If someone has cancer, they can refuse treatment and will require medical support based on that decision. If someone has end-stage kidney disease, they can refuse dialysis and require medical treatments and resources. If someone is driving and has an accident, they may need to be rushed to an emergency room for treatment. There are many reasons people need medical treatment and resources, not just COVID. I have lost many loved ones this past year, but not one of them to COVID. I know many folks that have had COVID this past year. Some needed medical services, most did not. You are trying to require these employees to test every 7 days with no symptoms. What a waste of medical resources. They should be testing and treating people with symptoms, not healthy people. Can someone with any medical condition be discriminated against in the workplace? These employees are not carriers of COVID, but merely trying to earn a living. There's a requirement for an individual to make their own medical decisions. People with a physical or mental condition cannot be forced to take medications or treatments against their will.
Mm-hmm.
It is not for us to dictate who will be required to subject themselves to invasive procedures to prevent a disease they do not have. I, Counselor Sherry Abraham, will not be held accountable for any action associated with your directive to force invasive procedures on our employees.
Anyone else?
And that's what I have to say about that.
I also would like to add that even pressuring employees to bring proof of vaccination, that's their personal medical records. And several have voiced that they do not feel comfortable providing information like that. That's none of the government's business, quite honestly. So that's not something that Town Hall needs to maintain on file. So I completely disagree with pressuring people to bring in their medical records.
For the last 2.5 years, I've been caring for my mother. She has end-stage kidney disease. She refused dialysis. Her medical decision has impacted my life greatly. But you know what? I couldn't make that decision for her. I could not drag her down and make her have dialysis because I felt like it was what was better for her or me. I could not do it. She gets to make her own choices. And that is important, and it should be important for you, each one of you, to be able to protect the things you're willing to have done to your body and the things you are not. You know, you're concerned about a virus that you may not even know you have. Well, if you don't know you have it, then you're probably not going to die.
I think that is.
Well,
Go ahead, Councilor Holland.
Mr. Mayor Pro Tem, I do have some comments about item C.
Councilor Holly, go ahead.
What I would like to say is that I believe in personal responsibility and individual freedom. We're all familiar with HIPAA, the Health Insurance Portability and Accountability Act. It is a civil rights law which gives patients control over the use and disclosure of their own health information. I don't want to mandate employees present proof of vaccination unless they choose to do so. That being said, if an employee does not want to disclose their health information, I don't believe the town should require proof of a negative COVID-19 test every week. I went to the Mayo Clinic website and they said COVID-19 diagnostic testing is done to find out if you're currently infected on that particular day. It is an invasive test and could possibly, these are my words, it is an invasive test and could possibly introduce something to the body, especially when performed so frequently. And finally, the Mayo Clinic does say that certain groups are considered high priority for diagnostic testing. These include people with COVID-19 signs and symptoms who, one, work in a healthcare facility, live or work in long-term care facilities such as nursing homes or other places where people are housed closely together, and three, those that are being cared for in a hospital. So those are my thoughts on the subject.
Okay. So we definitely have had opinions and discussion. Is there anything else we need to discuss or talk about with regard to the three topics that we have today? If not, I would call for a motion to adjourn.
Wait, I just need clarification. Do we need to provide you these arguments and these suggestions in writing for you to come up with a resolution, or
I would-
how are you
I
on
would-
for action?
Counselor, I would welcome your suggestions and comments and any further discussion in writing. Yes.
To you, the clerk, and Carla?
To at least me and the clerk, but me, the clerk, and Carla would be nice.
Okay, thank you.
And so just to clarify again, are we adding these three items to Wednesday's agenda for action?
We will bring forward a resolution incorporating as many of the items we have discussed as possible, and we will do what we need to do with that at our next meeting.
Okay, I have a concern with that, because if we don't address these separately, the resolution may die for lack of majority. I'd like to suggest that we take these each separately so that we don't create a resolution that cannot be passed.
Well, I'll put something together. I'll take that suggestion to heart.
Okay, thank you.
One more item before we close, Mr. Mayor Pro Tem.
Yes, go right ahead.
I did hear Councilor Abraham say something about the number of meetings that we've had the last couple of months with budget meetings and now this special meeting. I don't know if there's consensus for us to have the next meeting in September.
I don't have a problem with that.
Just
Councilor Jaramillo is worried, however, that we're forcing the employees to do something against their will right now. Believe me, there's not going to be any immediate action one way or the other. However, I would like to let the council know that nearly 25% of our employees have already turned in their vaccination records, and I haven't had much, if any, pushback or discussion. Those who have been vaccinated are happy to supply it, it seems.
Well, that
So-
that was a pretty harsh email you sent out threatening disciplinary action if
Ca-
they didn't. So
Well, Counselor, you know, there's always time here, and time is a wonderful thing, and also discussion. That's why we're talking today. So if Counselor Harmia is worried about some action in the near future, I don't think it's going to happen between now and the first or second week in September, if that's the council's, that's the council's wish. And we can certainly take a heck of a lot longer to write a resolution than a week, or resolutions, I guess, if everyone's agreeable. I have no
I
argument.
hadn't thought about that because you would need to have it ready by Friday, correct?
That's correct.
we also probably have things we need to address already anyway. So we need to look at where can you pare everything down to give us plenty of time to look at this, and what can be moved to the meeting in September. And
Well,
are we planning on just having one in September, or are we going to have two?
I would say 2 in September.
Okay.
But do we want to move the meeting to the what would that be? The 8th of September instead of next week?
My recommendation that we stick to our second and fourth week schedule without deviation. As long as you're not going to implement something unilaterally without our input.
So
No, I would prefer to have the meeting myself, because I think we have to look at the financial report too.
Well, then we have this meeting next week, but we address this issue of the first week in September. But we can't make that decision, apparently.
Well, we could certainly discuss it, and I can have the clerk poll the council for their consensus. We can
That's fine.
do
Okay.
That's fine, yeah. Okay.
I would also like to recommend that you guys all get a copy of the personnel ordinance and look at it. And, as Audrey stated, in the state statutes, we can be held accountable to retort claims for these decisions.
Mm-hmm. I did want to see, Mayor Pro Tem, I know not a lot of callers were on earlier. If anybody else had public comment, it looks like there's 5 online. Would you be willing to unmute them and see if anyone has any comments?
We're kind of at the end of things. I would have hoped that people would have come forward at the beginning where we had public comment. So I think we'll probably get plenty more public comment, and they're perfectly welcome to email us, etc. So I think I would stand for a motion to adjourn.
I move we adjourn.
And I will second. All in favor?
Aye.
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 Thank you, council. We will see you next week. We adjourned.